All right, everybody, welcome. This is First Strike Vet. We're going to do kind of like a basic DD on ITRM. Got a few people in here to ask questions and kind of help me along as well, just in case I forget something, which is definitely a possibility. So we'll get right to it, I guess. So the first thing that I like to do is I usually look up the company's website. So here, let's go into this one. So here's their website, ITRM Therapeutics. I haven't done any research ahead of time, so we're just going to work through this as a team or whatnot. So usually when I get to their website, I kind of just take a quick glimpse around. This is basically where I always start off with is the website, just to see what they have going on, see if it's pretty well put together, especially with these stocks that are under $5. So I mean the site looks pretty clean. Go to news, kind of see what they've got going on. I know that they just had news recently. Regulatory update. Look through these, read these. Clinical stage pharmaceutical company focused on developing next generation oral and IV antibiotics to treat infections caused by multi-drug resistant pathogens in both community and hospital settings. Today announced that the company received a letter from the U.S. Food and Drug Administration, FDA, stating that as part of their ongoing review of the company's new drug application for whatever that all is. Let's see. No details with respect to deficiencies were disclosed by the FDA in this notification. And the letter further states that the notification does not reflect any final decision on the information under review in a letter to the company dated January 21st, 2021. The FDA has assigned a Prescription Drug User-Free Act goal date of July 25th, 2021 for completion of this review of the NDA. So what all that's saying is there's a little discrepancy. We don't know what that discrepancy was, but it doesn't play into the role of them getting their FDA approval for their NDA product by July 25th, it sounds like. So I would imagine that ITRM Therapeutics is going to be working closely with the FDA to get this cleaned up. So if we go into the chart, is kind of where I want to look at next, so everybody has an idea what the price looks like now. I don't know if I already had this preloaded or not. I did not. So let me go to the chart. Let me add. I haven't done any live videos for a while, so bear with me. I kind of forgot to get everything perfectly set up. I have mostly everything set up. Webull, okay. So now everybody should be looking at Webull. If you're not, let me know. Transform, fit to screen, stretch to screen. Yeah, I'm I haven't done this in a while, so bear with me, everybody. Make sure you guys can see that pretty well. So you can see there's a pretty big dip right there. Like I said, if you guys don't see Webull, let me know. So let me go into Webull. So you can see a pretty big dip pre-market. So this month, or after hours actually, on the first. The first was Thursday. So Thursday, so that was Wednesday night going into Thursday morning. Wait a minute. This is the second. So this is Friday. So yeah, after hours Thursday, pretty big drop off. And then pretty much sideways trading from then on out. So this could be finding like its bottom here after this news, which wasn't like terrible news. It was just news that was saying that there was a little bit of a discrepancy, right? So it's not the end of the world. This is the 1 hour chart, so I like to kind of scroll out to see historically where this, where it was sitting before. It's currently $1.42. It's down to $1.01 way back here. $1.21 back in April or May. So it's out of, you have to go back a few months to get back to where this price is. So there must have been a lot of hype coming into this, waiting for this news to hit. And then they have like this, hit piece that come out from the FDA, not a hit piece, but a little bit of negative news that came out, and you see it drop quite a bit, from 236 all the way down to $1.02, and then currently closed out at 142, 149 after hours. So that just gives us an idea of where the stock historically has been trading. We also know that there still could be some positive news coming in by July 25th. So that's all good stuff. So what I like to do after that is go figure out what the heck their product is. So we'll go back to their website, close out Webull, go back to their website for the completion of its review of the NDA. So then I can just go into their search NDA, see what the heck the product is that they're going to be getting. Hopefully get FDA approval for. I mean, this is DD. It can get kind of boring, but this is the way that I like to do things. So that's the one that we just read. God, I gotta search it again. NDA. And I'll try and keep my eye out for questions. If there is a question, somebody just let me know, because I can't look at Discord the whole time while I'm doing all this. Make sure that we're on the right site there. So we'll go to this one. September 30th. A clinical stage pharmaceutical company focused on developing next generation NIV antibiotics to treat infections caused by. This is just like kind of what we just read. With the U.S. It plans to proceed with the NDA submission for whatever the heck all that is, that bilayer tablet for the treatment of uncomplicated urinary tract infections in patients with quinolin resistance pathogens. We are pleased with the collaborative tone of our meeting with the FDA, and we believe that we now have a solid understanding of the agency's requirements for our submission and the focus of the review. Based on the feedback received during the meeting and from previous correspondence, we have confidence in our direction to move forward with the NDA package for sulopenem, for treatment of UTI due to the quinol resistant pathogens. We estimate that there are over 6 million urinary tract infections annually in the U.S., many of which are also multi-drug resistant, and this has demonstrated superior versus the other in treating these infections. I'm not going to try and pronounce any of these crazy ass names because they're just really rough. So it sounds like to me that they're coming out with a product that is people get become multi-drug resistant, so they have to come up with a new way of treating those people. So there's 6 million of those people, over 6 million of those kind of people that get urinary tract infections. So they're just trying to push this product out to them to hopefully help them get through their issue. So it's not anything like, it's not like cancer saving or anything else like that, but it just gives you an idea of, okay, who are they selling the product to? What is the product, kind of, sort of, in a broad idea. I'm not a pharmaceutical kind of person, so I don't know what all this stuff means all the time, but that's basically what I get out of it. So the next thing that I like to do, I mean, obviously I want to keep researching this more often, but I don't want to bore everybody to death. So I want to also look at Ortex. So we'll pop into Ortex and see what kind of data we have there. See how much the stock is shorted. How come I can't get that on my big screen? All right. So, cost to borrow 11%, utilization's at 5, days to cover's at 0.21, 2 million shares on loan, 1.15% of the free float on loan. So it doesn't sound like it's very shorted at all, which could be a good sign. This could have just been possibly some shorts that started pushing on this. Days to cover. So what we can use this for is we can kind of go back and look at. Got lots of options here. What am I looking for? We can look and see like how when did the shorts start lending. So this is security lending volume, that all the gray bars. So you can see kind of where they started lending out. Exchange reported. So it doesn't look like it got very much short. It looks like people just sold out. To me, it doesn't look like it was crazy shorted by any means, which can be a good thing. You can also just inside here as well, you can just kind of look, and sometimes it doesn't want to work perfectly right. But inside Ortex, it does have ITRM. That's not what I wanted. ITRM. You can actually, there's a lot of information inside of this as well. It's been a while since I've actually looked in here. So you have your short information, trading signals. So you can pop up here and it'll tell you the 29th of June, trigger type was RSI. RSI got up to 80 to 90, so it was a sell, available for 29 days. Recommend holding for 26 days. So if you would, go short or put puts on it, you could hold it up to like 26 days to make your 32%, is what it's saying. And that's from the 29th. It also said the 29th was a buy. God, that's kind of hard to scroll. Just perfectly available for 14 days. Type 3. So there's a lot of different other information in here as well that you can kind of just get an idea of what's going on. RSI 3.5 stars. 3.5 stars. So this just gives you an idea of like what's going on. They have a bunch of different triggers that pop up on here. As you can see, there's a lot in here that say buy, sell. It just goes all the way back. So I would imagine the sell is after the announcement of the FDA saying that there was a discrepancy. So that's why this sell popped up. So there's that information. All right, I do see there's I can't read the stream, but they are referring to MRSA and VRE. MRSA and VRE. I don't know. If you know, that'd be great for me to know. I can't read the stream. Back on the website itself. Let's go into, yeah. So we'll go back into press releases. All I saw in there was UTI. So I guess what we need to do is the FDA has determined the advisory committee meeting. Let me just finish up with Ortex first. And I'm still showing you guys Ortex, right? Yep. So yeah, that to me it just says like I don't really think that it got shorted to oblivion off of what had happened. It just looks like to me people sold out because they were scared that it was really bad news, which it isn't. People like to let little things freak them out. inside the stock market. So this could have been somebody that bought. Let's go back into Webull real quick. That's kind of all I have for Ortex. So we'll pop back up into Webull. So these people could have bought like way back in here. They were selling out all of a sudden. You never know. So they could have been selling for a profit at that point, and this just kind of scared them a little bit, and they're just like, we're out. Make our money and walk away. You don't have to worry about it anymore. So this would be a good time to possibly buy back in. It looks like it has a nice ascending level of, so we can draw up some trend lines. You know, this is looking, I don't want to use that one. That one's pretty drastic based on what's going on. So draw a quick line from where the dip was to there. Looks like it's headed upwards to me, which is a good sign. Definitely barcoding like crazy, it looks like. Barcoding. Definitely looks like barcoding, but still, nonetheless, it's still heading in the upwards direction, which is what you're looking for when you're buying into a stock. So now we can go back into the website itself. Get rid of Webull, get rid of Ortex. Back into this. So we want to search into the review of NDAs ongoing. So we want to look into this other word that I couldn't pronounce. This one right here. So we want to research this inside here. Search, copy paste, copy paste. Posters and presentations. I don't want to look at all that. Let's go back with control paste. I don't like to have to do that every time. All right. ITRM initiates SURE-1, a phase 3 clinical trial of oral sulfonylurea in uncomplicated urinary tract infections. Is that me? That's a prolific issue among the elderly UTI. Yeah, I used to have my ex-fiance used to have a daughter that was younger that had a UTI almost like every month, it seemed like. So, yeah, UTIs cannot be fun. I know that much. And so, let's just read about what they put about that word. So, clinical stage pharmaceutical company developing antibiotics against multi-drug resistant pathogens today announced its initiation of the first of 3 clinical trials. In this trial, known as SURE, I like that. 1. Oral sulfonylurea combined with propinacin in a bilayer tablet is compared to oral ciprofloxacin in women with uncomplicated urinary tract infections, just like KMO just said. Sulfonylurea is ITRM's lead compound and novel antibiotic for treatment of gram-negative multi-drug resistant infections. We are delighted to begin our first phase 3 clinical trial for early in the 3rd quarter. Consistent with our prior guidance, the commencement of our phase 3 program marks an important milestone for our company. So this is just them announcing that they are in their phase 3 and they were going to do a bunch of research. And this was back in August 9th of 2008. So obviously they did a bunch of trials, and now they're to the point where they're sending it to the FDA, and they're waiting for the FDA to say, okay, your findings were good or your findings were bad, and they're that's kind of where we're at right now with this stock. And like I said, that announcement should be between now and July 25th, like we read earlier. But this is how I just kind of start off my DD. I don't want to dive way into this because one, I'm not going to be buying into it because I don't have any funds right now. I'm still currently in MMAT and AMC, and all of my funds are currently allotted to their spots for right now. I bought quite a bit of MMAT when I was low, so I didn't buy enough because my average isn't where I would like it to be, but I'm holding strong at a pretty decent price. So if you guys have any questions, I didn't want to go way deep into this, but I just wanted to give everybody an idea of how I start off my DD. You notice I didn't look right at the chart right away. I went straight to the website. You know, if you can't find the company's website, it's not worth even looking at. So I'm going to open it up for questions real quick, and then I'll kind of stop the recording, and then we can just move on into if somebody else wants to talk about something, do DD on something else or something else that they see, we can definitely do that. So if anybody has any questions, we'll just start with that right now. No questions. Come on. Somebody's got to have a question. And you guys can feel free to unmute and ask questions live, but like I said, it will be recorded, so it's up to you. If you don't want to hear your voice, that's fine. No, that's all I see. Everything I see is UTI. That's all I see about this one, this particular news catalyst that's coming up. It looks like that's all that it's for. Yeah. I mean, if I were to go farther into it, I'd look at more products that they have coming out, maybe some other trials that they have going on as well. Because it's not, this company, I would imagine, isn't just this one thing, right? I'm sure there's other stuff going on inside of it. I would hope that they have more going on for them than this one clinically drug in trial 3 right now. Like I said, this is just a basic beginning of full-on DD. I would spend hours if I was really interested in buying into the company and I had the funds for it right now. How is Ortex data analyzed? I have an idea what any of those numbers mean. So, okay, so we'll leave that for after I close this out, and we'll talk about Ortex. And I'll start like another fresh video maybe, and we can just talk about Ortex. Ortex is expensive, just so you guys know. It's not cheap to buy it and hold it. But there is a lot of information in there. So, and if you guys ever need a short data or anything for a certain stock, you guys can always DM me, and I can try and pull it up as fast as I can and get you guys that information for a stock. I can't always be can't always reply right away because I'll be at work, but yeah, if there's anything you guys want to see on Ortex, I can always shoot me a DM or at me or something, so I'll get a notification on my phone, and I'll make sure I can get you whatever I can in a timely manner. Usually it's pretty quick. KMO knows that I do a pretty decent job of getting him short interest data. Okay, I was waiting for you guys to ask it, but it didn't come up. So I'm going to go back into Webull and just show you guys a few quick things there. I like to see if anybody's, paying attention, or what everybody kind of knows. I'm not trying to hold that against you guys. I'm just trying to, I don't like to give out all the information. I like to see if anybody's like going to question me on something. So I do want to pop into Webull again. God, I can't. I just haven't done this enough. So in Webull, you can go in here and you can look at options. You can look at their profile, their news, financials, analysis. All this stuff is all inside Webull. So something that you want to look into is their financials. So you want to go in here. You just kind of want to take a quick look. I'm not the best at this, but you want to take a look like year to year. Are they up? Are they down? You know, some quarter three of, so September of last year, they had, what's that say, 8.57 million, down 70.33%. What the heck? Short-term, so cash and cash equivalents, 186.54%. March 31st of 2001, 66.64 million. Year-to-date, 202.19%. Quarter four, they had 14.51 million. Quarter three, September, they had negative 70% at 8.57. So I don't know what happened here, but that's I mean, from there to here is great, but what happened on quarter three? So you just kind of want to look into all the financials as well. Other receivables, you know, they were negative, and then looks like they were way positive here. You just want to see like where they're making money, where they're spending money. Total assets up 172% as of March 31st. You know, back in September they were negative 48.43%. So that's a good sign that they're year over year is getting much better each quarter. Accrued expenses, you want to make sure this isn't getting really crazy. So September, they had negative 83%. They had $2.9 million worth of accrued expenses. Quarter four, they had 2.4 million. Quarter one, they had 2.73 million. So like, for me, that kind of says, okay, they did all their research. Their research is kind of dying down, and they're just trying to get it approved so that it doesn't cost as much money. But they're still spending money, obviously. Liabilities. So you just want to look through all this stuff and pay attention to where they're making money, where they're losing money. Like I said, I'm not the best at this, but you can look at their income statements, their balance sheet, their cash flow. It's all right here on Webull. So that's always good to have a understanding of where they were and where they are now, where they spend their money, that kind of stuff. So that's always something you want to look at. Charts, options, I'm sorry. There is no options, so that makes it really easy. Sometimes options can give you an idea of bearish or bullish sentiment sometimes when it's available. Obviously, this stock doesn't have them available, so we don't have to worry about it. But yeah, fundamentals are always important. I'm not the best with fundamentals. I usually just go with the momentum of the stock and go from there. I like to look at the fundamentals just to see if there's anything crazy. You know, if they're all of a sudden losing crazy amount of money, then something's obviously wrong. You don't want to be inside that stock. So if anybody else has any quick questions on just basic DD, I'm not going crazy. You know, like I said, we could go and spend hours looking up all this information for their UTI drug information. But I don't want to go that far. So if there's no more questions, then we'll just end this video, and then we can just kind of move on. If anybody has questions about anything else, we'll talk about Ortex and go from there. So I'll give you guys like 10 seconds to either come up with questions, or we'll just be done with this. Okay. So everybody, thanks for joining this one. This is basic DD for ITRM, mostly just basic DD and how to start, where to start at, what I do. So thank you guys for watching, and see you next time.